Okay, so let's start. Good morning, everybody. Good afternoon, good evening. Please confirm you can hear me. Can you hear me? All right, thank you very much, Basil. We are trying to make sure that we have others join us so that we will start what we will not continue waiting for them. Okay, yes, thank you, Hereda. Thank you for joining. So if you know someone that needs to be here, if you know that you have somebody who needs to come and learn this today, please send the login details, send the link to that person, ask that person to join. It is totally free. You're not paying for anything today. Like today now, you're not paying anything to be here. So please tell that person to come and learn. We want to teach you from the words of our knowledge. We want to give it back to you free of charge. Okay, so we want to get as many people as possible to join this session to come and learn. All right, so welcome to Amdoranalytics. If today is your first time joining Amdoranalytics program, we want to especially welcome you. Thank you very much for joining. This is our first boot camp in the month of April. This is our first boot camp, right? So we are very glad to have you here. I am very glad to have you here. Thank you very much for joining. And let's do something very amazing. Let's say Happy New Year, Happy New Month to everybody. And then let's welcome special people in our midst, like people that are joining us for the first time. Now, if you know that today is your first time joining Amdoranalytics Bootcamp, like today is your first time joining Amdoranalytics Bootcamp, can you type 1? Just use the comments and type 1. Type 1 in the comment section. Type 1. Let's
Sorry, can I
welcome
just
you.
ask a question?
Yeah, please go ahead.
Is this for project management? Because usually the one for project management usually comes.
This is not project management. Why? You need to join the project. Check your group chat now. This is not where you're supposed to check. Check your group chat. Your group chat. Your project management group chat.
All right, thank you. Bye.
All right, so let's welcome people that are joining us for the first time. Hello, Henrietta. Thank you very much for joining. Let's see. Okay, Solomon. Erika. Okay, so if you know that today is your first time joining Amdoranalytics Bootcamp, so we just want you to type 1. Type 1 so that we can welcome you. We want to welcome special people. Let's get everybody on board. Okay, thank you very much for joining us, Jacob. Jacob, thank you very much. Welcome to Amdoranalytics Bootcamp. Welcome to Amdoranalytics Data Analytics Bootcamp, right? So while we are waiting for others, because we know that many people will join us, Shika, if you like, send this link to all their DMs. I need to get everybody here. Yeah, if you can hear me. So while we're trying to wait for others, we are going to proceed. Thank you very much, Adeyeye. Thank you very much for joining. Okay, so my name is Chinyere, and I am joining you from Lagos, Nigeria. So I want to know where our audience are joining us from. If you know, if you're joining us from Nigeria, just type Nigeria. If you're joining us, I would have said let's use Nigeria. Let's use a country flag, but let's not do that, okay? So if you know that you're joining us from UK, just type UK. Nigeria, type in Nigeria. We want to welcome you. So I'm joining from Nigeria. So just type in the comments, use the chat, and tell us where you are joining us from. UK, that's Basil. Basil, thank you very much for joining us from the UK. So guys, let's keep that coming in. Let's type. Okay, South Africa, that's Leader. UK, Adeyeye. Thank you very much for joining us. You are going to live here with Ogochukwu Juliana from Nigeria. Ogochukwu, thank you very much for joining us. Okay, let's keep that coming in. I love the energy. South Africa, Erica. I love the energy. Let's keep that. Let's just type. Tell us where you're joining us from. Okay, so let's welcome you in a special way. Okay. Kelly, joining from Kelly, okay? Okay, thank you very much for joining us. We'll go. Okay, without wasting much of our time, so just guys, just keep that coming in. Let's welcome you. While we are doing that, we are going to proceed now. We are going to proceed. Welcome to Amdoranalytics Bootcamp. Like I said, if you know that you have somebody that needs to be here today, please send the link. Send the link. Call them on phone. Ask them to join. It is free of charge. Come and learn from our wealth of knowledge. We are sharing it free of charge today. Now, let's tell you about Amdoranalytics, especially for those that are joining us for the first time, right? Let's tell you about Amdoranalytics. I don't know how you heard about Amdoranalytics. Maybe someone told you about us, and you feel like, okay, I want to know what these guys are up to. What is Amdoranalytics? Who are they? What are they up to? Okay. So Amdoranalytics is an edtech company. Okay, so this program is for those that want to become data analysts, but they want to become data analysts. Maybe health, I'm going to talk about it very soon anyway. Maybe I've heard a lot about health sector. I want to become a data analyst, but I want to become a healthcare analyst. We are going to talk about it very soon, so you understand that you need to start somewhere. Okay, so let's welcome you to Amdoranalytics. Amdoranalytics is an edtech company, that's educational technology company, right? So we are that edtech company committed. You see that word? Committed to empowering individuals to become global talents through our comprehensive technologies, through our comprehensive and accessible training programs. So we are that edtech company that you can trust, that edtech company that you can, that can give you all when it comes to delivering values. Okay, so we are that edtech company. Just calm down. I'm going to share very soon. Right, so our mission is very simple. Our mission is to bridge the skill gap by equipping learners with in-demand skills. In-demand skills. A lot of people have reached out to me, start asking me questions like, which skills do you think that I should go for in 2026? Let me tell you something. All the skills, all the program that Amdoranalytics teaches here at that we teach here at Amdoranalytics, they are all in-demand skills. I mean, they are all in-demand skills, right? So what we do is to enable learners to learn all these in-demand skills and every day to make informed decision, drive innovation, and create positive change. Get that? And create positive change in the tech-driven world, particularly across African continent. That's our mission, is to make sure that everybody, the Black community, that everybody are well equipped with the in-demand skills. Everybody are well equipped when it comes to technology. The Black community are topping it. We are all equipped, right? So for over the years, we've done this over the years, and we have trained a lot of people, over 6,000. Well, this 6,000 is just anyways. So we've trained over 7,000 people here at Amdoranalytics. We have trained over 7,000. We have helped them to transition into the tech ecosystem, and not just that, but start earning well. Okay, so we specialize in training individuals in the field of data analytics. Pay attention. These are the courses that we take here at Amdoranalytics. We teach you data analytics, business analytics, HR analytics, cyber security, data engineering, AI engineering, project management, and data science. All right. So, of course, I don't want to tell you about our tutors. Our tutors are experts. You are going to be seeing one of our tutors today. Yeah. Okay. So let me share something about Amdoranalytics. Right. I have one of my students. I have some of my students here. I mean, people that just started program. So we have batches. We call it batches, or we call it cohorts that we run here at Amdoranalytics. So every month, all right. So let's use the word every month. So every month we have new intake. We have people that will train on all these skills, right? All these career paths, especially people that maybe want to transition into the tech ecosystem and they don't know where to start. Especially people that have no knowledge. I mean, no knowledge about any of these career paths, and they really want to transition into the career path. Here at Amdoranalytics, we help you. Trust me when I say we help you, hold your hands and transition you into any of these career paths. Right? So maybe you want to start maybe data analytics or project management or business analysis, and you don't really know where to start. We'll help you, guide you through based on your career or your background, and we'll tell you, okay, you know what, go for this. I'll go for this. Okay, so I have one of my students who I would like him to share something. Let him talk about his experience with Amdoranalytics so far. I think I have 2 or 3 people, but I will call number 1 person. Basil, are you there? Basil is joining us from UK. He started his training program with Amdoranalytics last month, just very few weeks. Is it up to, let's say this is the third week. Basil, are you there? Can you hear me?
Yes, I can hear you. Good evening, all.
Yeah, good evening. How are you doing today?
I am good, and I hope everyone is well. How's the weather there? Yeah, it's kind of cold and mixed. I'm not sure what the weather is trying to do to us.
It's hot here in Nigeria.
Oh God, can you send some down here, please?
No problem, I will do that.
Okay,
Okay,
so
so Basi, can you tell us about your? We need your honest feedback. I mean, your honest feedback about Analytics program.
I, like you rightly said, I just started, but even then, I have been so exposed. A bit about myself, because maybe that would give some bit of context into why I'm so excited about the program. I retired from Chevron in 2013, Chevron Nigeria, and I came into the UK to do my master's. So I've been exposed, actually, been exposed because, like, my age, I'm like 62 now. So I think I've been around. I'm just trying to give a background so that I'm not just new, I've been around. But the Excel you teach is far different. And your attitude to teaching us is so good. You just use a phrase that you begin to pay attention. Every time he tells you pay attention, please pay attention, truly. You're going to get a nugget. I'm sure every other person that is in that class will understand when you hear pay attention. And she says it so many times, just to be sure that we are following. I thank you so much. I don't think I need to say more than, well, I think I've said enough already. It's a good program. Whoever wants to go in, please go in now and don't hesitate. You're going to get value for your money. Thank you so much.
Yeah, thank you, Basil. I would like to hear from Cherif. Cherif, can you hear me? I can see you here. I know you're one of my students. Cherif, can you hear me?
Yeah, good evening, everyone.
Yeah, good evening, Cherif. How are you doing today?
I'm good.
Okay,
Um,
so Cherif, can you share your experience with Analytics program so far?
sure. Currently, I'm not new actually in the tech field, but since I've started or going to tech, Amdoranalytics make me special because the reason why I say special, I've done my office package from 2019. I don't know nothing but Excel, nothing absolutely. Only Amdo analysis make me know something better. As for now, currently I'm on my work. Today practical that we done in class. So I'm currently on it. So I encourage each and everyone out there. Although never mind, currently I have sent the link to two people to join this class, to join this program so that they can hear for themselves. So I'm encouraging them to join and learn because think about online YouTube, go to other platform to learn is better, but you cannot get better understanding if you are not with the right people. So please, guys, join Amdo Analysis and be part of the tech industry. I thank you all.
All right, thank you, Sheriff. I just want to share something. Thank you very much, Sheriff. I know that this is coming on our way to you guys. Well, thank you very much for speaking out, right? I really appreciate that. So for those of you that are joining Amda Analytics first time, we want to establish this. That's what we do here at Amda Analytics. We are not bragging. If we tell you that we are good, trust me, we are good. Now, this is one of our group chats. I just want to share this. There are thousands of them out there, but I want to share this now, right? So this message came this afternoon. You can see the time this afternoon that this message came. So this is one of our students that dropped this message here, right? So let's read it together. God bless you. Okay, God bless you for your approach. You rock, boss lady. So I've had requests. The last video on functions apps. So I'm just going to where she mentioned that she'd be struggling to learn these functions, right? Like data analytics, maybe business index match and VLOOKUP, right? So, and she said now that she can actually close her eyes and solve all these things. And she has been struggling to get these things for a while. Now, this is us telling you how good we are here at Amdoranalytics. I mean, how good we are. If we start opening all the group chats, you will see that these guys, we are not kidding here, right? Okay, thank you very much, right? Thank you very much. So aside from what we have here, this is just live testimony from our students. And we can, even if we discuss anything, which we did not discuss anything with the students, just trust me, this is on our platform. This is our platform. Nobody like platform. This is our platform where we have over 64 students, and someone dropped this afternoon. Okay, appreciating the good work that we do here at Amdoranalytics. If you school, there's a lot of them, thousands of them out here. And if you check our platform, you can check our YouTube channel, you will see testimonies of people that have gone through our programs. You can check our LinkedIn, our Instagram. Okay, so you can check us out on Instagram at official_Amdoranalytics. On LinkedIn, just type Amdoranalytics. On LinkedIn, you're going to see Amdoranalytics. Check our testimonies, check people that are the amazing things that people are saying about us, especially people that are through with their program here at Amdoranalytics, right? Thank you very much for joining us. If today is your first time joining Amdoranalytics, like I said, welcome. We want to officially welcome you to Amdoranalytics. All right, so now let's dive in. Okay, so this is our facilitator for today's program, right? So I'm the host, and this person here is the facilitator. All right, so let's talk about our facilitator. Our facilitator is the founder of Amdoranalytics. Say yeah, yeah. All right, so if you can hear me very clear, and you're not in a noisy place, can you say yeah, yeah? Just unmute and say yeah, yeah.
Yeah, yeah.
Yeah, yeah.
Yeah, yeah.
yeah.
Yeah, yeah.
Anyway, I'm impressed. I would like to say something,
Yeah.
but I'll be waiting after at the end of the class.
Okay, Ibrahim, I know this is your first time joining, right? You said you are
Yes.
impressed.
Exactly. The link was sent to me by Sharif. Actually, he has been telling me about this.
Oh,
Actually, I'm impressed.
Thank you very much. Thank you, Sherry, for sharing this link. Thank you very
I'm
much.
just wishing myself that I'm just wishing what have I been doing all while doing nothing
Yeah.
on media, while you guys are here going far.
Wow, that's very great. Thank you very much, Ibrahim, and thank you, Sherry. Thank you for sharing the link. You see,
Yeah, but one thing, please.
Yep.
At the end of the class, please, I would like you to explain to us, like for us who are new, how to join and how to go about this data analysis, because we are new in the program actually, and we have been eager to do this course for quite a long time, and we have been actually looking for a right channel. So since we are now here, I believe this one can be a better place for us. So you can direct us, for us that are new currently, because we are listening, we are following up.
Okay, thank you very much. Don't worry, just stay to the end of the program, right? Just stay to the end of the program. I'm going to show you how to register. I'm going to share with you how to register. Very easy, very simple, right? So our facilitator is the founder of Amdoranalytics and the CEO of Amdoranalytics, right? Very good tutor. Her name is Chinyere Chukwuka, right? She's a data scientist and a data analyst with close to a decade of experience in this field, right? Gotten across data, technology, and innovation data-driven environments. Apologies. So her expertise spans across telecommunication, governance, finance, and edtech sectors. Okay, she has been doing this over the years, especially when it comes to training, comes to teaching. She has been in this field for over the years anyways, right? So she studied economics. She has a strong background in economics, econometrics, and development economics, right? So she's very good at what she does, right? So let's talk about what she has done, like her improvement of success stories over the years, right? So she has trained over 6,000 participants. Now, when I mention 6,000, I mean over 6,000 participants. Like I said, she has been doing this over the years. She has been training people. See, there's difference between training people and helping people, holding their hands, helping them to transition into to the tech ecosystem, and not just transitioning, but securing their first tech roles. Okay, she has been doing this. So welcome, and let's welcome our facilitator. If you are with me, say yeah, yeah. Yeah, my people. Thank you very much for joining. So for people joining for the first time, this is our slogan.
Our base is too much.
What do you say, Ibrahim?
Yeah. Our base is too much. If we say yeah, so
okay,
I don't know.
Your base is too much. Okay, that's fine. All right. Okay, so we are going to be discussing something very, very important. I mean, something very, very important. Okay, So the facilitator is me, right? My name is Chikoka, and I will be training you in this program today. I'll be holding your hands, show you how you can transition into the tech ecosystem, even without any prior knowledge. Okay. Now let me share something with you. So many people reached out to me last month, I think 2 months last month, asking me, "Oh, Chinelo, I want to transition into the tech ecosystem. I have a background in health. Which career path do you think that I should go for?" You know, a lot of questions around that because of their background. But before I proceed, I want to tell you something. I studied economics and I am in the tech ecosystem today. Now, if you're kind of person that you studied economics or anything that is not computer science related, I want to tell you something that you can move into the tech ecosystem. You can become a tech professional, like you can become a tech pro, like people like us. Okay, we are not bragging now, but that's just it. You can become a tech pro, right? And be impacting lives as well. Okay. So that question was because of a lot of things that started happening in the tech ecosystem. You start hearing about healthcare, data analysts, and a lot of things, right? Now let me share something with you. There's what we call domain knowledge. Okay, domain knowledge is an added advantage to anybody that wants to transition into any career path, right? You need to understand that when you're starting your journey, I'm going to be talking about the data analytics now, I'm not going to be touching data science and other career paths. Okay, so data analytics now. So when you want to transition into data analytics, here, very good. You are going to be learning three main. Other ones are just added, right? But three main softwares. Number one is Excel. You're going to be learning Excel. You need to master Excel. So many organizations are still using Excel as their database. So you need to master one of the data visualization tools like either Power BI or Tableau. But here at Amdoranalytics, we teach Power BI. So you need to understand Power BI, how to navigate Power BI. Then you need to understand SQL. Now we use SQL. We advise people to learn SQL and master SQL very well because SQL is the highest when it comes to database, right? We use SQL because a lot of organizations are migrating from Excel to SQL, right? So now these three main softwares are the main software that data professionals, especially data analysts, uses in their career path, right? Now, if you are now a person that works, let's assume that you're working in the health sector, and you really want to master any of these tools, or you want to know how you can then change that maybe your background, how you can move it into the health tech ecosystem and then still use it. I want to tell you that you need to start with what? Learning data analytics. Now, when people hear about data analytics, they will feel like, oh, maybe it's not really my part because I'm in the health sector. No, the answer is no. Let me tell you something. Being in the health sector is a very good thing. In fact, it has given you so many advantages because you are kind of person that you have been seeing numbers every day. That's what we call, I think, electronic health record, right? So as someone who is in the health sector, you need to master that. We use that to extract data, extract health data. Okay, we use that to extract health data. Now, someone who is in the health sector, that is another advantage, right? So you need to learn that one. But let's assume that you and I are people that studied something like economics. I studied economics, right? So, and we want to transition into the data analytics, or want to transition into the health ecosystem, tech ecosystem. And after that, you feel like, oh, I think I feel that the health part, or maybe being a health analyst is something I can do. What do I need to learn? You don't need to go and learn something new. It's still that same thing that you have. The only thing that you need then at that moment is what we call domain knowledge. Now, domain knowledge is when you transition into a career, or when you transition into a field, you start learning the scopes there, the scope of work. You start learning who are the stakeholders, what are the data like, how do they extract their data, what are their internal data like, what are their external data, what are they like. Okay, so these are the things that you need to start learning. All right, so you don't need to start learning new things or learning new. No. So I am a data analyst, right? I studied economics. I can decide today that my niche, I want to pick my niche to be what? To be between the healthcare sector, just as a data analyst. One thing I want to teach you, or I want you to know about being a data analyst, is that there is nowhere you cannot work. As far as they are working, they are extracting data, you can work there. Okay, you don't really need to be a nurse before you can be work in the health sector. right? So you don't really need to be, of course, when it comes to data space in the health sector. So you can be a data professional and still work there as their data analyst. The only thing is that you need to start learning their languages. You need to start learning things. That's where domain knowledge comes in. So you need to learn, you need to master their tools. You need to master, yes, I've been working in this sector for over the years. I've been working in power sector for over the years, and I've been using these tools like Power BI, Excel, SQL, SQL, Python. I've been using that. When I move into health sector, and still as a data analyst, it's still the same tool that I will be using, right? But then I need to master the environment. I need to understand their language. I need to understand their data language, okay? So that you have been in the health sector before does not mean that you should not learn Excel, that there is any particular tool that you want to be learning. No, there's no particular tool that you need to be learning. You need to master Excel first. It's when you master Excel. Now, pay attention. I want to share something with you. There's something I shared with my students 2-3 weeks ago. I told them about being a data analyst. Being a data analyst is not about the tool that you're using, right? It's not about Excel, it's not about Power BI, it's about solving business problems with that same tools. And that's what we're going to be doing. The only thing that you need to understand, for a person like me, that I don't have any background in health and the healthcare, I will start using healthcare data to solve problems. I will start learning the healthcare language using their data. I will start that when I build my portfolio as a healthcare analyst without healthcare background. I'm building on projects. Okay, build projects. So you need to understand this. So you don't really need to maybe go back to school again to start learning things about the healthcare because you want to become a healthcare analyst. No, you can start building projects, and that is what we are going to do today. So why am I sharing this? I'm sharing this because for those of us that really want to, we want to be everywhere when it comes to data. You want to be everywhere. All you need to do is to get data from this space and build on that. You can, there's what we call you can decide to pick a niche, but trust me, I do tell my student, I wish I told my student today, before you get to that level where you say, oh, I want to pick this particular niche, I want to focus on this, maybe I want to become a healthcare analyst, I want to focus on this, you have at least like 6 to 8 months in data analytics. You need to master the tools. Okay, so that's what we are going to be doing today. So let's talk about health data analytics. It's still the same thing with data analytics. Don't allow anybody to deceive you. The only thing is that you're solving problem with healthcare data, like maybe malaria data, cancer data, kidney data set, all those things, which their data are outside there. We have their live data, and which we are going to be using one of them to solve problem today. You see that it is easy for you without any background to still go out to work as a healthcare analyst in the hospital without having any healthcare background. All you need to do is to build projects, understand their language, right? So let's look at what we have here. So we said that health data analytics is simply using data, which is when we talk about data, we're talking about information and process information, right? Raw information to improve healthcare decisions and outcome. To improve, that's just it. So we use this to solve a problem. Okay, we use that to solve a problem. Now, a healthcare analyst is someone who looks at healthcare data. Now, who looks at healthcare data and turns it into useful insight that helps hospitals, doctors, or governments make better decisions. So you look into organization, healthcare, hospitals data, look into hospitals data, right? Help them to make decision with that data. You understand? So you don't really need to go and be studying it from the beginning. No, you have the knowledge of Excel. You have the knowledge of Power BI. You know how to turn data into insights. So you can use their data. With that, you are now a healthcare analyst. There is no big tool that you want to go and be learning over the maybe months, years. Yes, there is a place of building. There's a place of domain knowledge. Okay. So we're going to be doing something very amazing today. Let's look at the data that we're going to be solving today. Now, if you pay attention to what I have here, right? So, second. So this is hospital's data. Okay, this is from a hospital. So this is their patient ID. Patient ID simply means the ID number, right? We know when you go to hospital, they will give you a card. Let's use the layman language, right? So this is their card. This is the age. You know, when you go to hospital, you start collecting your data. What is your name? Your age, your all these things, your blood group. So this is the blood group, this is the gender. So this is the medical condition. Some are suffering from hypertension, some are suffering from asthma, some are suffering from cancer. So we are going to be looking at it together. So this is the admitted date. I mean, the day that we admitted in the hospital. This is the doctor that attended to them. Okay. So this is the name of the hospital. Okay. So this is the insurance provider. You can see the billing amount, the amount that they were charged. This is their room number. This is their admission type. Some were elective and the other one, I can't remember. So this is the discharge date. Okay, they were admitted so date and they were discharged so date. So this is the medication. Some were taking ibuprofen and some other medications. So the test results. Okay, test results, we can see some are normal, some are abnormal. Right, so this is the latitude and longitude of the hospital. So this is the data that we're going to be working with. So you've understood that we want to use data, and this data is from a hospital. Now let's dive in. We are going to be using a tool called Power BI. Okay, like I remember when I said something about the tools that you're using, you are going to be using as a data analyst. Now let's look at what I have done prepared for us. Now you can see we have let's say people that are suffering from cancer. So you can see this is the date of their admission. Okay, so this is how they were admitted each day, the number of people that are suffering from cancer. So this, you can see from cancer, we can see that we have more female that are suffering from cancer than more male. Okay, so by age group, this age group 65 plus, they are the age group that have the highest rate or highest number of cancer patients. Okay, they have the highest number of cancer patients, followed by age 45 to 55. Okay, so we have asthma. So we have the asthma, we have arthritis, so we have diabetes, we have the obesity. So we're going to be looking at this together. So let's do something. Let's see how we are going to answer this question using Power BI. So Power BI is a Microsoft visualization tools. Like I mentioned earlier, I mentioned that we have different tools. We have Excel, we have Power BI, we have SQL. These are the main tools that data analysts use. So let's open. We're going to be using Power BI to answer this question. Shika, if you can hear me, I need you to send another notification to the group. So we're opening our Power BI. So we need to get our Power BI. So don't worry about how you can install Power BI. It's very easy. It's very, very easy. Okay. So to install the Power BI is very easy. So let me look at this message. Please, can we get this data set and how can we get the Power BI to practice this demo? So I'm going to show you how to get the Power BI. We can hear you. So we're going to take more questions. It's not the time for questions like all this kind of questions like data analytics and data. Please, can you mute? Can you mute? Okay, so this data set, we are going to show it at the end of the program. Okay, so we will have attendance that will go on, right? So when you fill that attendance at the end of the day, we are going to send the data sets to you. Okay, so make sure that you fill the attendance, especially for those of us that are interested in transitioning into the data analytics career path. Just fill the attendance. We are going to reach out to you, share the data set, put the slide, the material, everything that we are going to be using today. we are going to share them. Both the recording, we are going to share them with you. Okay. So how to get the Power BI, we are going to share everything with you. So let's get the data set. So I'm going to go to my get data. So when you open a Power BI, this is a Power BI. So you can see get data. So we want to get our data into our Power BI. To get our data into our Power BI. So I'm going to select Excel because that my data is in Excel worksheet. It's in Excel worksheet. So I'm going to click on this. So you can just drop your questions. My colleagues are here. They're going to answer your questions. Right? So I'm going to select the data set. We're going to be using two data sets. Okay, two data sets. Healthcare analysis. So I'm going to click on that. So our data is loading. So we have our data here. So this is the one we're going to work with. So I'm going to highlight it. Now in Power BI, because I'm using Power BI, I'm going to be using the word Power BI. There's what we call ETL. ETL. So Erica, please can you mute? Can you mute? Thank you. So we have ETL. So ETL simply means extract, transform, and load. Extract, transform, and load. Okay, so what we have done now, we've extracted our data. So you can see transform, you can see load. Okay, so we're going to transform. So when we click on transform, it's going to take us to Power Query. Okay, Power Query is a built-in engine in Microsoft Power BI. Power Query is a built-in engine in Microsoft Power BI. Power Query is like where we clean our data. Okay, where we clean our data. It's not like it's where we clean our data. It's made for data transformation. So we use Power Query to clean our data. So this is our data here. This is our data here. We have one more data to bring here. So I'm going to click on new source. I will click on Excel. New source. I will click on Excel and I will click on health condition. So this is the second data. Use second data. So we highlight it here and then we click on OK. So we highlight it and we click on OK. So this is our two data sets that we are using. And we're going to have it here. So I'm going to select the first one. So the first thing I need to do is to rename it. I'm going to rename it from data to health data. So it's not a must to do this, okay? It will never affect the output of the data. So I'll just rename it health data. Yes, so I have it here. Now, there's what we call data understanding. Data understanding. This is at the place where you try to understand the data, find out what's going on, what do I need to do, what do I need to get better, is there anything that I need to fix? So one thing I want us to do here, now if you pay very good attention to this age, you can see we have numbers. This is numbers, right? So this my data is loading. Let's give it a second to load. I'll see it here. So I'm going to click on this filter here, and I'll click on load more. Filter, just click on this, click on load more. It's still loading, still loading. So we have the age 13 to 89. Age 13 to 89. Okay, 13 to 89. Now there's something I want us to do here. I want us to group this age. That's what we call grouping. So we want to group them that in case, not in case, we want to find out which age group, right? Which age group do we have highest number of cancer? Which age group do we have highest number of maybe hypertension and all that, okay? So we cannot see that using this column. So we need to group them. So I'm not gonna deep in, go deep and start telling you why. Okay, I'm not going to go deep. Maybe when you register for Amdoranalytics program, you are going to know the difference and know why we are using that. Now, to get that done, we are going to use add column. So we are going to use a function called add column. Now, if you come to your Power BI here, right, this is Power Query. So when you click on this, you can see transform. Okay, you can see add column. Now, we are going to use add column tab. Now, why are we using the add column tab? Because you want to add a new column. Okay, so I want to add a new column. So I'm going to click on this and I'll add conditional column. Now, pay very good attention. For those of you that are joining us for the first time, here at Amdoranalytics, this is very simple. Like, oh, my students, trust me, they know this. That's what we call conditional column, right? If function. We know that if function is a conditional function. Right, so this is how to do if function in Power BI. This is how to do if function in Power BI. So we're going to select this, click on this add column, conditional column, pardon, this conditional column here. So we have the name, new name bracket. So this is, we're going to name it age brackets, sorry. The name of our new column. So I'm going to name it age brackets. So we'll come here, we'll say if age is less than equal to, so the age is between 13 to 89, yeah, 13 to 89. So we're going to say if this age bracket, age column, right, if it is less than equal to, this is the only thing that we're going to do here, if it's less than equal to 25, okay, that means it's the age between 13 to 25. Now, what am I saying here? Now, pay very good attention. If this age, if the age column here, right, the age column bracket here, if it is less than 25. Now, when we say that something is less than, that means from 24, 23, you know, down to 0. So those things, they are less than, okay? So anything that is equal to, we use the equal to or less than, that means from 25 down to the last one, which is 13. Okay, 13. So I'm going to add another clause, and I'll say if the age is less than or equal to, let's say 35. Sorry, 35. That means it will be from 26. So this stops as stop at 25. So it will be from 26 to 35 to 35. I'm going to add another clause. If age is less than equal to 45, it will be from 36. So it will continue from where this one stops, right? So 36 to 45. Okay, so if age is less than equal to 55, so it will be from 46 to 55. Another one, so if age is less than equal to 65, okay, so this one starts at 55, this one will now be 56 to 65. So anything less than 65 is, let's say 67 plus, okay, no, 66. 66 to, we can use 66 to, or we just use 66 plus. That means from 66 and above. Okay, from 66 and above. This thing is very simple. All right, very simple. Just because you're seeing it for the first time, if you don't understand, just calm down. We are going to explain better. All right, so we are going to explain better. So I'm going to use this. I'll add a data type. I'm not going to start telling you why we are cutting, why we're changing the data type, right? Like I said, there's a difference between learning this and learning the in-depth here at Amdoranalytics. So I'm going to move this column. It's not a must that you move it anyways, but I love to move it. Just hold down, click on top of it, drag it. That's what I've just done. So just drag it, be dragging it, be going. Or there's another separate way to do that anyways. But I'm teaching you as a lady. So I'm going to drop it on top of this. Okay, so now pay attention to what I have here. You can see we have, so the first column here is 66, 64, you can see. Let's put them somewhere. So this is 77, that's 66 plus. This is 23, that is 13 to 25. Okay. So 52, that's this to this. Okay, that's very correct. So I'm going to come to home. This is the only thing that we want to do here, right? The only thing. I will come to home, right? You can see here, close and apply. You can see here, I use the drop down, you see close and apply. Okay, so before we do that, this second data here, I'm going to rename it. I will name it condition, health condition data. I'll just name it condition data. Okay, this is the health condition data. So I'll come to home. This is home, right? Come here, close and apply, close and apply, close and apply, close and apply, close and apply. So it's very simple. What we have done now is very, very simple. Very simple, right? So we are going to start visualizing it. We are going to start using this data to answer business problems, questions, right? We are going to start using it to answer business questions, right? So it's still loading. It's taking its time to load. I don't know why it's taking this long to load. Okay, so we have it here. We have it here. Still loading. Okay, so there's what we call data modeling in Power BI. So there's what we call data modeling. So you come here, you can see my data, you can see that health data, you can see the condition data, okay? The model, okay? So using the conditioner, the medical condition, don't worry about this, okay? I don't need to start bothering you with what is this and why do they model and all that, okay? So in Power BI, we have three main views. Pay attention. We have three main views. Of course, you can see it here. We have 35. We have three main views. We have the report view. We have the report view. This is where we build our dashboard. Okay. So we have the what? We have the table view. Table view is where you want to see your data in tabular form. So you can see it here. Okay, still don't know why my Power BI is kind of hanging slow. So you can see it here. This is our table. This is our data in tabular form. Then we have the model view. This is where you want to see how the data has been modeled. All right. So let's go back to our table view. Let's go back to our visualization view. This is where we visualize our data. This is where we visualize our data. Okay, so now what are we going to do? We need to understand that's what we call DAX. DAX in data analytics. DAX. That simply means data analysis expression. Data analysis expression. So we need to find out the calculation. Simply means the calculations. Anyways, I don't want to bore you into the compressed words. So it simply means calculation that we do in Power BI. I'm going to be using the word Power BI because you're using Power BI now. So we need to calculate total patients. Okay, how many patients do they have? Like total patients, right? Or total admitted patients. That's right. So to do that, I'm going to click on top of this. I can do it anywhere. Just let's come back to the main data. How data, right? Click on the and click on what? New measure. Right click on top of the health data and click on new measure. Click on new measure. Click on new measure. Okay, so I'm going to clear whatever that is there and I'll call it total patients. So our total patients, oh my God. So our total patient is equal to, we are going to be using a function called distinct count. distinct count. Now, distinct count is a function that helps us to count values and remove duplicates. Distinct count. All these things I'm mentioning, they are very easy. I mean, the easiest thing you can ever heard of when it comes to DAX in data and Power BI, right? So very, very simple. Distinct count. Or you use the word count, but I want to use distinct count because I don't want to have duplicates. So equal to, we want to calculate the total patient. So that's what we want to calculate. So total patient is equal to distinct count is the function. I mean the function that will give us that, just like you are doing addition in Excel, sum in Excel. This is what we use here. Distinct count equal to. So we're going to be looking for patient ID. So we want to count the patient ID. So you can see it here. Want to count how many patients do they have, and to do that, we use their patient ID. Okay, to start saying that, oh, we have 10 patients, 5 patients. Okay, now we have it. Now, if you come to this, our health data, you will see something that looks like calculator. This thing here, it looks like calculator, right? So when you highlight the value in front of it, like highlight it this way, just check that thing that is outside, you will discover something. So you discover something, look at it, what you've discovered. Now let me turn it to numbers so that you see what I have. So it's showing us that we have 56 patients. Look at it here. We have 56 patients. So 56 patients, you can see it. We have 56 patients. Okay. So now let's dive into the things that I want us to analyze. I want you to pay very good attention. Now, when it comes to analyzing your data as a data professional, that's what we call data understanding. You need to really understand your data. What do I want to analyze? It's not that you carry your data, you start analyzing anything. No, what do I really want to analyze? What are the things that I will visualize that will solve this business problem? Remember, this is organized, this is a hospital's data, right? And they share the data set that comprises of the health challenges of the patient, right? So we want to see what are the total patients by health challenges, right? So let's look at what I have here. So we can see total patients by medical condition as health challenges, right? So you can see, can we see the most, is it threatening or most deadly health challenge that people are facing based on this hospital data? Remember, this data set that we're using now came from a hospital. So for us to do that, I'm going to go back to what we have here. So this is our total data. Why it's still highlighted? I'm going to look for conditional medical condition. This is medical condition here. I want to expand this thing so that you see it. This is a medical condition. So I will highlight the medical condition. I will highlight the medical condition. Look at it here. So change it to, sorry. So this is what I have here. Start column 5. So I want to have it in the chat. So I'm going to put it on a focus mode so that you will see it. Now pay very good attention. If you pay attention here, we have total patients by medical condition. Total patients by medical condition. If you pay very good attention, you can see that we have diabetes. Look at it here. The highest, the taller the parameters, the higher the numbers, right? So we have diabetes here. So it simply means that in this hospital, that we have the highest threatening disease to be diabetes based on the data of the people that have registered with them. So followed by hypertension, then obesity, arthritis, cancer, and asthma, right? Let's go back. I want us to look at something very important. We have age group. Can we see how these guys, can we see the, let's see the total patients by age group. Which of these age group are suffering from this disease more? These are the things that organizations are expected, that people are expected to see. Trust me, there is nobody that will tell you to solve something outside what they've shared with you, outside your data set. Unless you're making research, you understand? Maybe working on a thesis, you want to make research, you want to find out. So that one, you know that you want to make more research to know what is actually the cause of this illness. I don't know if you understand, but we are not moving to that part now. By the time we move to that part, is when you fully, when you are very good with the basics, the fundamental, we then move to research methodology. Now, let's look at total patients by age bracket. Okay, let's look at total patients by age bracket. Now, I'm going to highlight this age bracket and total patients here. Then I will look for age brackets. Look at age brackets. Why this is still highlighted, right? So I'm going to select the age bracket. So look at it here, age bracket. Now, if you pay attention, you can see that the age bracket that is really suffering from illness is between the age of 66 plus. Okay, 66 plus. That's why most times, in most cases, they will start telling people to be careful of what they are eating. Be careful of what they are eating. Right, so this is from 66 plus. You can see the age bracket from 66 plus. Okay, so let me put it on focus mode so that you see it very well. So after 66 plus, you can see that between the age of 46 to 55, follow that, and this 56 to 65. This is strange. This can be. There's something going on here. Just give me a second. I'm a very curious someone. I want to find out what didn't go well. Just give me a second. I want to check the Power Query. Health data, the conditional data, edit that. So it's loading. Let's give it a second. Okay, this I'm using equal to. They're not equal to. Is less than or equal to. It can be equal to, less than or equal to. Yes, less than or equal to. So there was a mistake there. So I tried to refresh that. That's why we are professionals. So when there is a mistake, you take charge of that. You need to find out where the mistake is coming from. Okay, you need to find out where the mistake is coming from. So this, we need to. Okay, this is still loading. It is still loading. Still loading. You can see that it's still loading. This data we are using is a large data set. It's a large data set. We have over 55, look at it, over 55,000 rows of data. 55,000 rows of data. Yes, look at it now. Something just changed here now. I see that. Something just changed. It's not possible. I looked at the data. I know that it's not possible. It's not possible. So look at it now. So now it's correct. So we have the highest people suffering from these deadly diseases to be people from the 66 plus. Okay, followed by 56 to 65 till the youngest people. Right. So let's go back. Now we want to see the admitted age days. Okay, which of these days do they have the highest number of patients? Okay, this is looking at what we call trend analysis. Trend analysis. Now, to answer trend analysis question, we use line chart. We use line chart. So I'm going to select line chart. Don't worry. So all these things, if they are sounding like jargons, trust me, it's very simple. Because when you start, now let me share something with you. When you start your training with Amdoranalytics, we are not going to dive into data visualization. It's not possible. It's not possible. Like not possible, right? So we are going to take it from the very basic. I mean, very, very, very basic. We hold your hand and teach you how to understand the data. You need to understand the data before you start solving a problem. So we will move into total patients by admission dates. Expand that. I'm going to see the hierarchy. So I'm going to select the hierarchy, right? So I'm going to select the hierarchy. I want to check the day. or I want to check the day, so I don't need the day. So what I have here is the year, the quarter, and the month. So which is fine. The year, the quarter, and the month. Don't worry, just leave it this way. Yeah. So I have this. This is showing us the year. You can see we have 20. Let me expand that so that you see. So we have 2020. Okay, 2000 to 2004. So this data that we are working with now is like 2000. Okay, 2019 to 2004. That's 5 years data. So 5 years data I'm working with. Now this is showing us a year. If you want it to show months, right? You can see it here. It's showing us year. Okay, this is year. Show like this. This is showing month and year. Month and year. So let's go back. Go back. Let's leave it this way. Let's leave it this way. Let me see the other things that I visualize here. So total patients by gender. Let's look at which of these gender are suffering from this illness more. Okay, this is very important. So I'm going to select total patients and gender. So this is gender. So you can leave it here, or you can change the. I think mine. I'm using donut chart. You can use donut chart or exchange chart. Okay, you can use donut chart or exchange chart. Now let's do something so that we'll proceed. If you pay attention to this I have here, you can see I have image. I have an image representing all the health conditions. So this is so if you click on this is arthritis, this is asthma. So this is asthma. So from this asthma, look at it here. This is the asthma. So you can see the people, asthma by gender. Pay attention, pay attention. When we look at asthma by gender, we can see that the highest people suffering from that asthma is what? Female. Why female? Everything is just female. So we have male, right? To have the 28%, that's almost 29% of the male are suffering from asthma. So let's come to cancer. So you see, when I select these things, I'm having it's not changing. So cancer. So this is cancer. So when I select all this, you can see this image changing. So I want to show you how you can use this image on your Power BI. This kind of image on your Power BI. So let's go in now. So the same thing with diabetes. So you can see diabetes. So everything is just female. Wow. Is there any problem with us? So let's see how we can achieve that. So I am going to get a table. This is not a must. I'm going to get a table. I'll select the health condition. Not this now. I'm going to close this. Close this. So I'll type in the URL. So when I click the URL, so it's just showing me the URL. So don't ask me how I got the URL. So I'm going to share with you later. Okay. So now I'm going to select this. I'll come to this table view. I'll click on that. Okay. So scroll down. This is the URL. Just click on top of it. Just a second. Just click on top of it. Just come here to data category. Data category. Turn it to image URL. So turn it to image URL. So it's working. You can see it is working. It's working on it. So let's go back to this. So you can see what we have now. Okay, so this is what we have. This is what we have. I put it on a focus mode, so you'll be seeing that they look at all their health conditions, right? All the health conditions. So when we go back, we want to be seeing one. So we can increase the size, just like I have on mine. But let's do something quickly. So I'm going to go to slicer. I will select slicer. I'm going to look for the let's say that slicer to use. Okay. Okay, so let me just select. I'm looking for one visualization tool. Okay, look at it here. So I'll select this slicer here. So when I select that slicer, I'll select this medical condition. The medical condition. So when I click on this will be changing. Okay. When I click on this, you see it changing. This is how I was able to, navigate that. Okay. So to do this, I want to change this data type. Just give me a second. Give me a second. It's not going to take your time. Okay, so let's change the background of this our chart so that you'll be able to see it very well. So I'll go to view. Come back here. I'll select dark. Okay, so go to view, select dark. So you can change this color here, these bars. So to do that, just after this, we're going to proceed. After this, I'm going to show you something. Just wait, but after this, I'll show you something very amazing. I mean, tell you something very, very amazing. So I'll click on this, right? I'll go to my format. So I want to change the color, just like color. I want to show you how you can change the color to what I have here. Okay. So to do that, I'll come back here, go to format. So you just select any of the charts, go to format. This is format. I'll come to columns. So you can see color here. Then you select any color of your choice there, cut it there. So the same thing with this. They are very, very simple. So make sure you maintain accuracy. Make sure you maintain the, this one is line. This is line chart. So you go to where you can see line. Look at its line here, right? And then scroll down to color. So expand the color. From this color, select this. So you can see what I have here, the color of the line. If you want to add shade, so you can just click on this. Okay. Want to add what I have on my own. So this is, I'm going to use this drop down here. I'll select anything. If I select cancer, you see all of them moving. If I select diabetes, you see all of them moving. Okay, obesity. So you see the image changing here. So I'm going to show you how to increase the image when we are back from something. I want to show you something very, very important. Tell you something very, very important about Amdoranalytics. Right. So if you have any question, the same thing with this. So let me show you something that I've done on mine. So just come back here. Effect. I love to use shadow. So I'll click on shadow. The same thing here. Go to click on this. Go to this. General. Effect. Scroll down to shadow. So this one here is showing obesity. Just give me a second. Come back here. I'll check that obesity so that's my dashboard will be back. Okay, so this is what I have. This is health analyst. This is how to become a health analyst without having any background, like any prior background in the health sector. You've seen that, right? We started with telling you that these are the tools that you need to learn. So you need to understand that as a health person or someone who is a health analyst, you need to learn how to use Excel. You need to learn how to use Power BI. This is Power BI. Now you are using it to solve business problems, guys. Remember what I told you guys that I told my students a few weeks ago that being a data analyst is not about the tool. It's not about the tool. It's about solving business problems. And you have seen it now. You have seen it now, rather. You've seen how we were able to use health and health data to solve this business problem. You've seen how we use it to solve this business. Now we can use it to answer these questions. Now, if somebody, let's assume that you're working in the health sector, this data is from your organization, right? It's from your company, right? So you can see that we have a column where we have the names of the patients, their health conditions, the kind of drug medications that are given them. We even see how they were admitted and discharged. There's a lot we can do here. We can, in fact, if we go further, we even want to find out. We might even want to find out how many days do they stay in the hospital. And this, to do that, we use a function called date if. Okay, date if, and if you're using the date if, what it simply means is we are minusing the admitted years from the discharge day. I mean the admitted day from the discharge day. So it will give us how many days they stayed in the hospital. Maybe they stayed like 4 days, 5 days. And we even want to find out if people that have cancer, are they the one that's staying longer than the people that have asthma? So this is our questions that we are asking using data, right? Using data. So you see that it's not, you don't need to start over to start learning how to become a health analyst or healthcare analyst, or moving to school to go and study nursing because you want to be a health analyst, right? You can by building on by building projects. And let me show you how you can get some of this data. If you go to World Health Organization, you can get this data. If you go to what's the name of this website again? UNICEF, you can get this data. There's a lot of places where you can get this data. This is one thing. Now, let me share with you something very, very important. For those of you that want to transition into the career path, right? Someone mentioned something that's someone, one of our students, that's Cherif, shared this link with him. So let me tell you about Amdoranalytics that you don't, something about Amdoranalytics then that you need to know. Something very great about Amdoranalytics. Why we are doing that, I'm going to show you that. So let's take questions. So let me look at chat and see if you have any questions for me. Then I will share something very great about Amdoranalytics that I want you to know about. So let me take your questions. Okay, so we're waiting. Okay, so if you don't have any question, then let's dive into duration of the training, days and time. Okay, that's where we are going to now. Very, very, very important. Okay. Just give me a second to share my screen so that we dive into that. Start date. Yeah, I'm going to talk about it now. I will talk about it now. Okay, so confirm you can see my screen very well. Can you see my screen? Okay, very well. So let's talk about Amdoranalytics and what we are doing here. So last month we started something very great, right? We are on a mission to bring up 1,000 people to transition into a new career path. We are on a mission to bring 1,000 students to transition into a new career path, right? Of course, it's just when we talk about 1,000, we actually mean 1,000 per month, right? So we were on a mission to bring at least 1,000 students to transition into a new career path. So to achieve that, here at Amdoranalytics, we decided to give out a huge scholarship program to everybody that is ready to transition into their career path. Here are the programs that we offer here at Amdoranalytics. We offer data analytics, pay attention, data analytics, cyber security, HR analytics, AI engineering, data science, business analysis. Okay, these are the programs that we offer here at Amdoranalytics. Now, you will be asking, okay, since you guys are offering a huge scholarship program, tell us about it. Since you're on a mission to bring 1,000 people to transition into the career path, a new career path, tell us about that, okay? So all these programs that you are seeing here, they are very, very much expensive. If you have been into any of this program before, you study any of these things before, you know how much you pay to start your career in any of these. Is very, 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 like huge amount of money that you're going to pay, right? So here we said, okay, you know what? We want to bring a lot of people into the career path, and we don't want them to break their bank to start their career path. And in order to achieve this, we said, okay, you know what? Our AI engineering and data and cyber security, instead of you to pay over 1 million for people that have joined our program over the years, especially people that joined November, December 2025. If you join any of our program, you know how expensive our programs are. You will know how expensive. You can go on YouTube, watch the videos of all the classes held during that time. You will know how expensive our programs are. And that's because we are delivering values. I mean, values are top notch, right? At least we heard from 2 people, and I show you the live text. That text was dropped this afternoon from a student that joined our program. These are people that started their program 3 weeks ago. I mean, this is their third week. I started the program third week ago, right? So we know how expensive our programs are because we are delivering value. We are very, very much interested in students getting value for their money. And in order to do that, right, we said, okay, you know what, we don't want to have that outrageous amounts on our program because you want to get good number of students to start their program. So we reduced the training fee from 1.2 150,000 naira. So if you're starting your career in cybersecurity, if you're starting your career in AI engineering, you are paying 100. We started this journey last month. Take note of something. This journey is supposed to end that last month. It's supposed to end that last month. But because of a lot of inbox, a lot of messages, we decided to, okay, you know what, let's extend it to next month. Okay, let's extend it from last month to this month. And trust me, after this now, this will be the last time that we're going to be having this scholarship program. So we'll go back to our normal price. Okay, we'll go back to our normal price. So instead of you to pay 1.1, 1.3 for our program, you are paying 150,000 naira. That is about $108. If I'm not mistaken, that's about $108. Okay, so if you are registering for HR analytics, data analytics, data engineering, data science, project management, business analysis, you are paying $77. That's 100,000 naira. $77. That's 100,000 naira. And this program is going to last you 3 good months. Now pay attention. 3 good months. And then a lot of people, there are people that sent us messages. Okay, I love what you're doing and I really enjoy and I would like to be part of what you're doing, right? But I don't have time. I don't want to be attending classes every day like as you guys are doing. There's what we call Google Classroom. We have LMS, right? So let me show you. Like I always tell people, what we are doing here at Amdoranalytics is hands-on projects. This is data analytics. Pay very good attention. This is data analytics. This is what we did today. So if you pay attention to this, you can see week 3, except project 1. All our programs are project-based. You are going to be seeing real-life case studies. So we work on this project now. Today, we work on this QMAT data, QMAT store, okay, QMAT superstore. We help this organization to analyze their data. They share their data set with us and ask them to, just like what we just did now, okay? This data that we use now is from a company, it's from a hospital. Okay, so we analyze this data today. This is like, look at it here. We solved this business problem today. We did it today, right? So if you are you want to start your program with Amdoranalytics and you don't have, look at LinkedIn optimization. This was posted 9th. That was 2 days ago. We had our LinkedIn optimization, and as you can see here, part 1. We're still going to have part 2. I'm coming there. Right, so you can see all our classes, you can see their videos. So if you miss any of our classes, you have access to the videos. Okay, you have access to all the videos. You can go back and watch and practice. See, guys, this is not, we're not making mouth, we are not bragging, but what I'm telling you is nothing but the truth. Nothing but the truth. What we do here at Amdoranalytics is value over everything. Go on YouTube if you want to be sure of what we are saying here. Go on YouTube, check our video. Like you can see here, hands-on. Everything that we are going to be seeing is hands-on. You can see it here. Hands-on program, like project-based program from the beginning. You can see it here from the beginning till the end of the program. So any program you want to start, look at project management. If you watch the class, you can see they are all live classes. Look at week 2. This for the people that started 3 weeks ago. Okay, you can see this is the lecture material. You can see it here. You have access to all these things. You can see this is the recording of the class. All our classes are being recorded. This is for cybersecurity. You can see for cybersecurity. These are for the people that start. Everybody here that started last 3 weeks ago. This week 2. So you can see lecture slide. Okay, and you can see the recording as well. This for Sunday. This is for Saturday. Okay, so this is for data science. If you go back to the data science, you will see, look at Python Foundation. You can see the installation that they did. And today, the class is ongoing as we speak now. The class is ongoing. This is AI engineering. Okay, this is AI engineering class. If you go there, you see their classes. This was what they did last weekend. today's class, which is Saturday, is ongoing as we speak now. So this is business analysis. This is for data analytics. So every career path, everything that you need to know, this is HR analytics as well. Okay, this is HR analytics. The class is ongoing as we speak. Well, this is week 2. So today is week 3, and you can see that the class is ongoing. That's why the video is not yet here. All right. So let's move into other things. For the program fee, I have discussed that with you. Trust me, the program fee, what we are doing here is like bonus. Or it's not like it's bonus, right? Nobody can sell any of the program. Duration is 3 months. You are going to be getting 2 months live training. Pay attention for the person that asked me about the training duration. 2 months live training and 1 month custom project. 2 months live training and 1 month building on projects, building portfolio. So 1 month is mainly meant for building projects. Throughout 1 month, you are building projects. So the program is going to last for what? It's going to last for 3 months. 3 months. So our classes are weekends, Saturdays and Sundays. Our classes are weekends, Saturdays and Sundays. All right. So now this is for the training fee. Trust me, now pay very good attention. Like I said, this fee is just for this month. It's just for this month. Okay. This scholarship, it's going to end on 15th of April. Is it 15th of May? 15th of May. That is when this discount is going to end. Okay. And trust me, that is going to end on 15th of May does not mean that we should not continue the program. The research is still ongoing. And again, another thing again, I want you to understand, we have a certain number. Remember, we said that we are on a goal, on a mission to get to 1,000 students registered for all these programs. So we're on a mission to get 1,000 students to transition into career path as low as 100,000 naira. I mean, as low as 100,000 naira. So it simply means that if we have that number of students that we're looking for, we are going to stop the discount. We go back to our original fee. We've done it over the years, and we're going to do it very soon. So we are going to stop the scholarship program. We go back over to the original fee. So if you're still interested to start, why not? Because values are being delivered. Go and ask questions from people that have started their program with us. Ask them questions about Amdoranalytics and what we do here at Amdoranalytics. They will tell you for free that this is value over everything. Like I said, see, this is not we just bragging, no, we don't do that here. We don't do that here. If you go on our WhatsApp group or on our any of our platform, our YouTube, you are going to see testimonies of people that are through with their program here at Amdoranalytics. Okay. Just if you check on YouTube, let me not take you that. Let me tell you about other things that you need to know about Amdoranalytics program. Why you must. Not you should, right? Why you must train with Amdoranalytics. Number one thing is practical program. Our program is hands-on. Hands-on program. Right? Very, 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 very practical program. Right? Which you've seen, right, this afternoon, this evening, we'll be able to collect a hospital's data, analyze it, use it, and answer problems. Right? So it's always a hands-on program. Practical programs, that's what you're going to be seeing here at Amdoranalytics. And number two thing that you need to understand, we are training you with standard tools. We're telling you about Excel, right? And we're telling you these are the things that you need to know about Excel. We're not just training you on Excel because others are, mentioning learn Excel. No, we teach you how to use Excel to solve business problems. We are not telling you how to use Excel. We are telling you how to use Excel to solve business problems, right? Another thing again you need to understand about Amdoranalytics programs are, let me tell you something about our instructors. Please permit me. This I'm not going live, right? Permit me to share something with you about our instructors. This is not for me now. This is let me say feedback, facilitators feedback. Let me see if I will see that. Okay, this is it. Facilitators feedback. We are doing it live now. This is live. Nobody's changing anything. It's from me and you now. You and I are the one looking at this together. So nobody's changing anything. This facilitators feedback. You can see facilitators rating form. This is March cohort. That's people that started their program 3 weeks ago. This is their feedback. This feedback was just sent only on. We're going to look at this. So let's open and let's look at it together. all of us are looking at it together. So we're going to go straight to this thing. So we're doing this together. So this will be very, very convincing to you, to let you know. Nobody, I think those students that are not here, I didn't tell them what to type. We are not typing because we want to get feedback from our students to know where we need to improve on, right? So let's look for, okay. We're going to start from 30th of March. This is 30th of March. These are all their feedbacks. This is all their feedbacks from the 30th of March. Now let's go back to what is your honest training, honest feedback on the training. Look at it here, the honest feedback. Let me tell you one thing about this feedback. We don't know who is feeling it. Even me, like the facilitator, I don't know who feel. That's how we structure the feedback. Okay, so let's start with the, okay, start here. It's very educative and exciting, insightful. It's probably training and exciting. Master of her skills and great teacher. This is, we don't even know the person's name, but maybe we'll check that later. Okay, let's see. Okay, this is for Shinyere. Okay, Shinyere is our data analytics facilitator. This is from another person. This is very detailed. This is too much, so I don't know. I want us to go to short feedbacks. Okay, so somebody is asking something. Let me just get back. Can you paste the attendance link again? Okay, thank you very much. Thank you very much for that. So let's go back to that again. This is too much, but I just wanted to see it. Okay, in a way that you can see them. Okay, so this is Chidima. Chidima is our business analysis tutor. You can see Chidima is very good. The training is very good. She should slow down and explain in a layman language, so to stop me from being lost in the class. This is a feedback. We are not filtering anything. It's live feedback. So interesting and well detailed. The facilitator is good and she should keep it up. The training has been good so far. I am learning a lot. The facilitator is patient with us and very thorough with her explanation. Okay, he is good and has good presentation, but it seems there's time constraint. I'm not going to deal with that anyways. So honest, for me, this is the first time I see facilitators ever ready to teach with a mind and honest spirit. So let's find out who this facilitator is. Let's find out. Oh, this is our cybersecurity facilitator, Oladimeji. This is for our cybersecurity facilitator. So you can see this is for Shinya. This is Ridwan. Ridwan is our data science facilitator. Let's look at the feedback for Ridwan. So yeah, he's good and has good presentation. But it seems there is time constraint. Okay, that's for the Ridwan. So it's not his fault at the moment. So this is for Shinya. This is for Admit. This is Shidima. Okay, so these are all the feedback coming from. This is Ifoma. Ifoma is our project management facilitator. So let's go and shake that. So you can see the training is well packed, and I also wish that some materials can be uploaded to us. All the materials has been uploaded, and maybe this person has not gotten it at the moment that he or she filled this form. Okay, so this is the feedback from all our programs. As you can see, nothing is filtered here. This is live feedback from our students, people that started their program on March. So you can see it, facilitators rating for March. Okay, so thank you very much, and let's go back to our let's go back again to our form, why you need to register with Amdoranalytics. Now let's talk about other things. Personalized mentorship section. We are going to go back. I want to show you something, so don't be in haste. Let me tell you something, right? Let me tell you one thing that you need to understand. If you want to transition into a career path and you really need a better place, you need to get convinced in it. So you need to be very, very convinced that this thing that these guys are saying, that they are doing it, so it's not that they're just saying it for saying sake, right? So we mentioned something like mentorship and support. Now let's go back to our let's go back to our Google Classroom. So let's pay attention to our Google Classroom. This is mentorship. We have mentorship. I want to show you something from a place where you can see the mentorship section very, very well. Very, 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 very well. Data analytics. I have other programs. So just give me a second. Okay. So I know I have a mentorship folder here. I have it in across all other programs. So anyways, let's scroll down to this part. So look at the mentorship, right? You can see you have all our every week, every Thursdays, I'm going to be meeting with different mentors. So look at this mentorship. What hiring managers are really looking for, how to stand out as a tech entry, okay, a day in my life as a data analyst. So we have a lot of sections for the mentorship program here at Amdoranalytics. If you check our LinkedIn, right? Let me show you something. Let me show you something on our LinkedIn. Let me show you something on Amdoranalytics LinkedIn. You can see a lot of mentors, right? A lot of mentors that have been on our platform talking to our students. These are the things that you really need to understand about Amdoranalytics. So let's go through Amdoranalytics program. Let's go to our LinkedIn. So you can check our LinkedIn. Please follow us on our LinkedIn at Amdoranalytics. It's loading. Or you follow us on Instagram. We're everywhere. Just look for Amdoranalytics on our LinkedIn, Instagram, YouTube, everywhere. Just search for Amdoranalytics and follow us. Come and enjoy the amazing thing that we do here at Amdoranalytics. Come and enjoy the amazing thing that we do. Okay. Another thing I want to show you here at Amdoranalytics page. I want to show you something. A lot of people have asking questions like, Shinya, how about your certificate? Somebody say, yeah. If you can hear me, say, yeah. If you can hear me.
Yeah.
Yeah, my people.
Yeah.
All right, thank you. So this is our slogan here, okay? So if you're joining us for the first time, thank you very much for joining us. Let me tell you about some of the analytics certificates, right? For a lot of people that do ask us questions like, Chinyere, can you tell me about your certificate? Is it globally recognized? Is it this or that? Okay, look at it here. Amdoranalytics is accredited, right? We are accredited academy. You can see it here. Please look at. It's still loading. Just give us some seconds. Okay. Yes, look at it here. Look at it here. Let me just put it on a global stream so that it's not showing. So, but just check our LinkedIn is everywhere. On our Instagram is everywhere. You can see American Council of Training and Development. Okay, so we are accredited by US Institute. Okay, by US Institute. So we are highly eligible for giving you a certificate that will help you to get job across the globe. Do you understand? So maybe you want to get a job and you start asking if Amdoranalytics certificates, can you screenshot or screenshot it? This is it, or screenshot it. All right. So you can screenshot it and use it. Just post it anywhere. Post it anywhere in the world and ask them if this is true or not. So you can see it here. So this Amdoranalytics, we are accredited. So certificate that you're going to be getting here at Amdoranalytics is globally recognized certificates. Or you say yeah again.
Yeah.
All right, thank you very much. Thank you. So
Yes,
let's go back to our this thing again. So all our training, they are beginners friendly. For the people that are joining that program first time and you started asking yourself question, I don't know if data analytics is something I can do. Come here without any, come with zero experience here at Amdoranalytics. Amdoranalytics will hold your hand. We are going to hold you. You have seen the live feedback. No filter. Nobody filtered anything. I mean, nobody filtered anything. It's live now. We have seen the feedback from our students talking about our programs, right? So now, of course, we've mentioned about the certificates, right? That will boost your CV. We've mentioned that. Another thing again is the guidance. 100%, 100%. We are there to assist you, and again, supportive community. One thing you need to understand about Amdoranalytics is that we are all supporting ourselves. We are supporting each other. The students are supporting themselves. The trainers are supporting the students. So it's a supportive community where you are going to have group of people that will hold you accountable for not submitting your assignment, for not doing well. So it is amazing. So we really want you to start your program here at Amdoranalytics. You see proven success. Go everywhere, like I mentioned, everywhere. Check about Amdoranalytics, our LinkedIn, our Facebook, our TikTok. It's on our TikTok. We're on TikTok, right? On our X, which is formerly known as Twitter. So just check Amdoranalytics everywhere. And we have our students. One thing that we do here at Amdoranalytics, I want to show you, right? If you go on LinkedIn, check Amdoranalytics, you're going to see some of our students writing their 90 days growth challenge. You've seen Amdoranalytics, people talking about 90 days growth challenge, 90 days growth challenge. That is what we do here at Amdoranalytics. We teach our students how they can grow outside, aside from what we are teaching them, grow, like build in the corporate, okay? Build, let people see you, let people know who you are, let people know what you're building. You understand? That's what we do here at Amdoranalytics. And if you check all those our students, go and check their pages, reach out to them, ask them about Amdoranalytics. They are students, we didn't pay them, they are the one that paid us, right? So they're getting value. If they're not getting value, they're not going to talk about it. So ask them questions. Maybe you want evidence, you need more clarity, you need more, I don't know, another thing again you need, but whatever you need, just ask our students. Okay, ask them. These people here, okay, these are our colleagues in the industry. So ask them, and any of the program that you want to start here at Amdoranalytics, no cap, you are getting 100. Now, I've told students something. The student that started program with us here this 3 weeks ago, they started in March. I told them something. I said, if you did not get value, like you did not get value for your money, of course, this is 90% discount that we are giving, right? 90% discount. If you did not still get value for your money, reach out to me and collect your money. Ask for a refund. So if you register for any program with any academy, and they are proving to you that if you do not get value, ask for a refund, it simply means that they know what they are doing in it. I mean, yes or yes?
Yeah. Yes, so.
Yeah. Yes, thank you, Saige. So it simply means that they know what they are doing. If for me to reach out to you, or for me to tell you something about Amdoranalytics, I'm as the founder of Amdoranalytics, I'm beating my chest to tell you that if you did not get value for any of our program, ask for a refund. So it simply means that I know what we are doing. All right. So to cut the story short, the program starts very soon, and registration is ongoing. I mean, ongoing. I want to beg you for something. Don't be stingy. Okay, don't be selfish to register for yourself alone. Register for everybody around you. People that you really want them to transition into a career path. Tell them about this whole 90% discount program that we are giving out. None of this program that you get at this rate, with this live training, sitting down every day, every time, Saturday and Sunday, talking to you, and weekly mentorship, LinkedIn optimization is there, Upwork optimization is there, CV review is there. All these things for 100,000 naira. That's $77 if you're paying in dollars. Okay, so my colleagues are going to be reaching out to you, and just you're on if you're on our WhatsApp group. So all we need from you, just go to the WhatsApp group and drop, how do I make payments? Someone is going to reach out to you now. Okay, for Ibrahim that just asked me how he's going to make payments. Ibrahim, I'm going to just tell Sharif to reach out to me, okay? And I believe Sharif will guide you on how to make payments, okay? But if you need to talk to me again, you want to talk to me, there's no problem. Please make sure that you fill the attendance form. We want to talk to you. We want to see you. We want you to register. See, let me tell you something. There is nowhere, nowhere in this world, if you like, you say it's a lie. There's nowhere in this world that you're going to get it this side. You're not going to get it. I'm the one telling you. Okay, there's no way you're going to get what we are giving here, what we are doing here. right? There's no way you're going to get it at this rate. And so let's take questions. We're open to your questions. Ask us questions.
Please, I've got a question. Am I free to speak?
Yeah, please go ahead.
All right. Okay. My name is Anne. Please, I don't know if I'll be asking something that is off point here. Can I meet you or speak to you after this program, if you don't mind, or should I go ahead and ask?
Okay. Yeah, you can meet with me just on the WhatsApp group. Drop. I want to speak with Chinyere.
Okay,
You're
you're
on our WhatsApp group, Abby. Yes, my name is Chinyere.
Okay.
Just drop on the group that I
Which
want to
of
speak
the
with
WhatsApp?
Chinyere.
Because I can see you guys have different WhatsApp. Which of the WhatsApp group, please?
Just drop anywhere.
Anywhere is fine.
Yes, just drop anywhere on the WhatsApp group.
Okay, thank you so much. Thank you.
All right. So this is Aisha. Aisha said, yeah, Amdoranalytics is doing well, maybe for the lesson. I am really enjoying the class I registered for. Amdoranalytics is the best. Can you see that? It's from our students. Thank you very much, Aisha. Advice is needed. The feedback, I didn't see any data science facilitator mentioned. This is data analytics facilitator. His name is Redwan. Let me show you. Where is he? Redwan is a very, very, very nice guy. I mean, doing absolutely well. Very good. I mean, very, very good. Okay, let me show you live chat, my WhatsApp chat with a student. I'm going to show you. So why this WhatsApp is loading? Okay, this student here. This student here. So this is our student. So she registered for data analytics and data science. She's doing the both together. So this is my live chat with someone. So you understand. So this is where she came to my DM. She said, "Boss lady, you are always on point with your videos. God bless you, the initiative. Do you know that you don't have to, just appreciating me, right?" So I want to show you where she mentioned Redwan. Okay, she said, "See our DS coach, that's data science." I said, "Good morning, ma. Any complaint, ma?" She said, "Awesome layout. I couldn't do data analytics." And no, she said, "No, none." I say, "Oga is good." Can you see that? Oga is good. This is live chat. I'm not supposed to share this on something like this, but that's fine. Say, "Oga is good." So let's go back to the facilitator. Redwan, his name is Redwan. Let's go back to this. Okay, look at Redwan. So let's scroll and look for a feedback. Say satisfactory. Can you see that? What is your honest feedback? Satisfactory. So let's look for it again. Now, trust me, it's not, maybe by the time you register, it might not be Redwan that you're going to see. It might be another person. All our facilitators said very detailed and useful, relatable scenarios. Very detailed and uses relatable scenarios. So this is for Redwan. Again, you can see that. So all our programs, right? Trust me, it's not about Redwan now. It's about what we offer here and all the facilitators that are going to be meeting. Okay, so this is Redwan again, where he said he's good and has good presentations, but it seems there is a time constraint. So there is a good feedback for all our students. I mean, all our facilitators. Okay, our facilitators. All you need to do is to make payments. Make payment. Registration is ongoing, right? So I don't know if there's any. I'm missing out any question here. Okay, so let's take another question. If you have any question, please ask your questions. Ask your questions. Ask your questions. If you have another question for me. What we do here at Amdoranalytics is not kidding. We are here for business. We are very much interested. So when people are telling me we are much interested in making sure that people get value. When people hear about academy, they'll be like, "Oh, this academy, what they do is to collect people's money. They don't teach." It's not here at Amdoranalytics. Can you hear that? It's not here at Amdoranalytics. We have our students across everywhere. Go and ask them questions, ask them about Analytics, ask them, tell me the truth, are these guys really good? Okay, so here at Analytics, we are much interested in your values, we are much interested in you getting value for your money. All right, thank you very much, everybody. You want to see you in the class. All you need to do is to make payments. Like I said, please don't be stingy and not be selfish, right? Pay for someone, tell people about this. Your colleagues, tell them about what we are doing here. There's one academy that you just find now. That academy, man, they're giving 90% discount. They're giving, see, instead of you to go and pay that millions there without getting any values, come and pay just 1,000 naira, just 100,000 naira or 150,000 naira, and enjoy values. I mean, millions of values. All right, thank you very much, everybody, and see you in the class. I want to see you. Of course, I love teaching, so I would like to see you because I would like to talk to you. I would like to impart. Okay, I would like to make sure that you